It's taped to my wall in my office. It happened this year. I had a patient bring me whatever the Filipino money is, 50p, and he wrote on this piece of money, um, "Thank you for doing my root canal. I was able to go to the Philippines and ask my wife to marry me, all because of you." And I have that taped to my wall.
Welcome to the Comfort Dental Podcast. Get a peek behind the mask with real people and real conversations.
So today I am so excited that I get to be with Dr. Jackie Blasko of Comfort Dental in Littleton, Colorado. And Doctor, before I set you up, I just want to say thank you so much for even letting me interview you today.
Absolutely.
Okay, so I'm dying to know, we're going to dive really deep into you as a dentist, but even outside of dentistry, what is it that makes you smile outside of dentistry?
I have 3 children. I have a gorgeous husband, 3 children. I love to travel. Uh, I work a day and a half. That makes me smile. I love that. I get to I have the best of both worlds. I get to be mom, and I really get to turn off and do that job. And then I get to go and be a dentist, and I get to turn on and do that job for a day and a half. So, yeah.
Now,
But I
as mom, are we saying young children, or what phase are we in?
I have a senior who we are exploring colleges for. I have a freshman who is a volleyball player, and she keeps me very busy in the gym and traveling with her, trying to pursue that dream. And I have an 11-year-old who is a typical third, and she is. We hosted 15 young ladies last Friday for a Galentine Day party, and she is by far my social butterfly. So they keep me busy.
So, doctor, what is it that drew you to dentistry even in the beginning?
I fell into it. I was in nursing school, and I was in a small town, and I wanted something more. So, long story, I met someone who was in med school and said, "Go to med school." I went away to college, and I took the MCAT, and it kicked my rear end. So then I took the DAT, and I excelled at that. And I had a girlfriend in undergrad who wanted to be a dentist more than anything. So I went and toured the dental school with her, and I applied and got in. So it wasn't like a lifelong dream. Medicine was definitely a lifelong dream. I knew I would always get excited in or near a hospital. Still to this day, I watch all of the ERs and Grey's Anatomy, and it's always been a passion to. It's hard to explain how excited I get about medicine. I always think maybe I should go back and do more with it in a different life. But so that's how I got into dentistry. It was just a series of meeting people and tests, and that's the path I took. So it came to me.
So within healthcare, what do you think it is about it? Is it the actual medicine? Is it biology that's always fascinated you? Or is it being a caregiver?
I think it's the human body. I think it's just the mystery of the human body and treating it, watching it heal. Again, teeth and dentistry is kind of, I think, an odd section of it. There's a lot of stress in the fact that everything is tiny, but it's not typically a life or death situation. But just the compassion and the ability to change someone's life behind that, I think it's just medicine. I cannot explain it. It's just something that excites me. Again, every show on TV that's medicine based, I'm watching it. Yeah.
Was there a moment early on when you found yourself in dentistry and you just knew, 100%, this was the right career for me?
Yeah, oddly enough, one thing I saw about myself even as a kid was if I repeat something, I get good at it. Repetition with a skill, can pick up and get well. I learned that. So dentistry was a good fit for me, I think, in the sense that it doesn't change a lot. Like the science behind it hasn't changed. So I'm on repeat, and it's taken years, but you get good at it because you're doing the same thing all the time over and over and over again. So
So in terms of your journey, finding Comfort Dental, was that something that kind of early on you stumbled into a Comfort Dental practice?
no, no, we were out here my husband and I are from Chicago, central, and I'm central Illinois. And my brother-in-law, who is also a comfort doc, we were all out here on spring break together, and he had lunch with Neil Norton, and who used to be with Comfort and was more like the recruiter for docs. And he asked us to go to lunch with him. He said it's a free lunch, and we both were like, we're not moving to Colorado. We have no interest. And it took one lunch. And here we are. We've tried to go back. We went back to Chicago in 2016, and then we came back here in 2019. So which was a lovely adventure. We now know we're in the right place. So
Yeah, I mean, if you love patients and getting to do dentistry, I think Comfort Dental is a great fit because there's never a dull moment. You're always busy, if I understand it correctly.
absolutely, absolutely. I think that was one of the most dreadful things about having a private practice in Chicago was how slow it was. Um, and Comfort, I do my best work when I don't have time to think. Like when you're just in go and you've got one to the next to the next to the next. And my husband and I joke all the time, like those are our good days. We don't like to sit around. You're not a comfort doc if you need to sit down and have lunch in between patients. We just thrive on the adrenaline.
So if a new patient comes in to your office today and says, like, why should I trust you with my teeth? What would you tell them?
I've been doing this for a long time. And it's taken years to have the confidence to say that. And it's taken many stories from others and seeing other people's work where you realize, ooh, I would not have done it like that, and I would have done it better. And you never want to get cocky. I think any dentist out there will know when I say you never get cocky, because the next time you go in, something will prove that you're not perfect and you're not the best of the best. But it has taken years to say, because I've been doing this for a long time and I'm pretty good at it. So, yeah,
And I think as a patient, you want your care provider to have some level of confidence.
absolutely.
For them to show up being like, well, I don't know. Like you want a high degree of like, yeah, if you choose us, we're going to take care of you and we're going to do it at a pretty high degree. So yeah, that definitely comes through. So doctor,
Hmm.
walk me through what a first visit looks like. Like what should a new patient expect?
Oh, well, paperwork, all the paperwork. X-rays. We cannot do anything to you without X-rays. I can guess. I know your teeth are beautiful, and I understand you've never had a filling before, but if next year you go somewhere else and they talk you into X-rays and I miss something because we didn't take X-rays, I'm liable. So we don't do anything without X-rays. You're going to get a full series of films. That's the very first thing we do. And then we ask, what brings you in? We try to address your primary problem, and we go from there.
I know a lot of individuals have, hesitancy or some anxiety about going to the dentist. Not everyone gets excited as if it's going to Disney World. Is there anything that you specifically do to try to put at ease maybe patients that you can tell are nervous?
I mean, talk. I think people appreciate a conversation, and I do run behind. That's my number one battle in life. Even yesterday, I had to sit a patient straight who I didn't feel had to wait that long, but I care and I will talk to you. If you are a nervous Nelly, I will take that extra time and even to try to pick up on your body language and say, do you have any other questions? Or are you feeling good? Or what's going on? Or what are you thinking? It just takes, I think, a little time. Sometimes we don't have it and we just don't. And there are times where that's not a priority for me. And if you need to have your hand held the whole time, maybe this isn't the place for you. I don't think like that, but there are days that I just simply do not have the time to hold the hand, unfortunately. And it's not fair. And that is the negative with, I think, our healthcare in general. But I feel personally to take that time and answer the questions, go over options, um, look at, x-rays with the patient. I do love to do that. And I know I've had people say, oh, I've never shown patients their x-rays. I just think if you could see what I see, you understand why I'm saying what I'm saying. So I do like to throw x-rays up and have them look with me. And do you see all your, bone loss? Do you see how big this cavity is? And talk about options and try to come to that decision together. Sometimes include them in their treatment um, without ever letting them talk to me into something I don't think is right. But I definitely like to include people into their plan.
You kind of like segued right into where I was going to go with treatment options. Like, I was, just a little bit more, if you could color it in, like, how do you explain, treatment options to patients that might feel overwhelmed? Because, patients, we don't know what we're not the
Right.
experts. We don't know what the consequences are of putting off treatment. And I'm sure it can just be overwhelming at times for a patient to understand what it is that's being presented. How do you handle that?
We start with money. I mean, hands down, money is the number one discussion to have because there's no point in me spending 20 minutes explaining to you, implant supported dentures if there's no way you can afford an implant supported denture. So, um, I don't, I mean, we definitely go over options and throw out generic numbers like an implant's this, a bridge is this, a partial is this. And very quickly, I think patients will give you a feeling on what they can and can't do. And like if a tooth needs a root canal, there's your options, either root canal at this cost or extraction at this cost. And you have a lot of other things going on, like if you spin that, what do we do about the rest of them? You don't want to leave behind everything else that could be saved. So, I mean, I think money, I start with money, all the treatment, full treatment plans. Kind of, I do, even if my assistants love to take one picture, especially when we're really busy and it never fails, I always end up leaving the room saying, take the FMX, which is a full series of films. And when I come back, we'll go over the rest of it. Because the patient will say, well, do I have anything else going on? Because I know if I spend this much with this option, what else do I need for the rest of it? And then you're like, well, hold on, we didn't get those pictures. Let's take more. And so it is nice to have that full series of films so we can give you an adequate answer to what you really have going on in your mouth, not just one tooth.
Now, doctor, with your private practice, was that something that, again, you just know or knew, I need to talk about money right away? Was that something that you've just always done, or was that part of more of the training from Comfort Dental?
Oh, it was I mean, I was a comfort doc for 15 years before we opened our own practice. So everything we did in our practice, we literally just tried to open I think our goal was to start Comfort in Illinois, was our goal. But the Medicaid system and the saturation of dentists in our location was ridiculous. So there were so many red flags, which people had told us. There's a reason why we're not there. But we kind of learned that on our own. But no, we treated our private practice the same. The problems with our private practice had nothing to do with the dentistry or the Comfort Dental model. It was more of our personal lives and that we, we're used to working opposite shifts or same shifts so that we could have some sort of time together and close the office down and travel when we wanted and not worry about it because we had partners. So when you own your own practice and you're used to having partners, that was where the problems came in. It wasn't the dentistry or the treatment, all of that. We've always, and I will forever just do it. I think now it's not really the Comfort way. It's just my way. Which was taught to me by Comfort. And it's just how you take care of a person. It's a good model and it works and it's successful because it's a good model. It sets the doctor up for larger treatment plans, taking care of the whole patient, utilizing the insurance benefits to the maximum, use this much this year and then next year we'll use this much and just playing the game. So it is just management.
From what I understand about so many of the lovely dentists that I've met and being a patient, I understand the natural reluctance that dentists have with finding themselves in that role of like, now I have to be a salesman. Um, and I can't stand that word. And I don't want to have to pressure anybody. But there's like a natural reluctance to kind of bringing up money with this like underlying almost belief that introducing this tension is going to be awkward or that somehow they won't be able to pay for it. And yet, as I'm talking to you, it sounds like that isn't some reluctance that you share at all. And if anything, it sounds like it's better for the patient that you have no problem just comfortably discussing fees.
Again, every once in a while I bring someone to tears. And I'm like, oh, like it depends on the person. Um, if you go too fast, like if the person, and I think that's something I've learned with experiences, when you look at an x-ray, not every tooth that you think hurts. And not every tooth that has a huge hole in it, the patient is even aware of. And it's again, many, many years of learning when you tell someone that tooth has to be extracted and they start crying and you're like, I mean, there's nothing left. What did you think? And they don't know. And it does take, again, lots of presenting things and then being, oh, this person wasn't prepared to hear this. Um, and it doesn't happen a lot, but every once in a while, again, that's why I show them the x-ray. Or I will start my wording with, so have you noticed that tooth is flat? Or are we talking about the one that's broken to the gum line? Like try to throw something like that in there so it's not such a shock to them when I now say, can't really do much with that guy. I think he's going to have to be extracted. So again, it's a little bit of a learning curve over the years. But money, I don't typically get patients to tears with money. Um, I'd have to go back to what was your original question. I feel like I've lost where I was going with that.
Oh, I think it was just something about the gift it is that you actually can discuss money in a direct way without all that, almost like head trash.
So,
That
like the
kind of
whole
normally leads to
taking
reluctance.
your, when I will joke with the patient where sometimes I feel like I said, this is how I feel when I take my car to the auto shop. And they like, oh, I was here for an oil change and now I need what? Like, I get it. But what I say to myself is it's their decay, their cavities, that's not my fault. I didn't do that. But it is my job to tell them what's in their mouth. What they do with that knowledge, that is up to them. And again, I'm not arrogant or you don't present it in the matter of like, well, this is your problem. But if I have to be comfortable with talking about money and this is what you need, you came to me for me to tell you what you need. If that upsets you, I am truly sorry, but it's my job to look at a picture and say, this is what's wrong. So I think I've taken myself out of the scenario as far as feeling bad. And I absolutely had more issues with that as a young doc. I would almost take responsibility with like, they had no cavities and I'm telling them they have 8. And you're like, oh God. And then you're thinking, oh, that's not my fault. Like, what am I going to pretend this one's not here? So, and again, the more you do it and the patient will come back and say, well, I was here 6 months ago for cleaning and you guys said there was nothing wrong. And now my face is swollen and you're telling me I need a root canal. Well, why didn't you tell me that 6 months ago? So, it's patients love to make it our problem, our fault. And so I think years and years and years of dealing with that makes you less sensitive to what their problems are and how much it's going to cost for them to fix it. So I hope that doesn't sound insensitive, but I think it comes from that where you're like, they blame you whenever you don't tell them or when you can't catch everything like you should. So, yeah.
How do you handle it, like when a patient, disagrees with the treatment recommendation or let's say wants a second opinion?
There's some papers up front you can fill out, and we'd be more than happy to send your x-rays wherever you want them to go. I mean, again, I'm put in a position where I do not need to make up treatment. I don't need to falsify records. I don't need to glorify treatment plans. I don't need that. And I'm so blessed for that. And that I hope that does not sound arrogant, but I don't, we have a lot of people to take care of, a lot. And
So
so
if
if you
what
don't
I'm
want,
hearing, if what I'm hearing is correct, it's that like, um, because of the volume, and that consistent, steady volume, you're not worried about bills getting paid in your office. Like there's so much revenue coming in that you're not having to pad a treatment plan or even be tempted to possibly give someone something that they really don't need. It's almost the same idea of like, I know a lot of people, myself included, that like going to Walmart for an oil change because that's really, there's no incentive for them. They can't like first of all, they can't like try to upcharge you for something else because they don't provide other services there. But it's also just the fact that like they make money on everything else that they're doing, that
Right.
they're just going to do the oil change. They're only going to do what you actually need. They're not sitting around and they're not busy. And then all of a sudden you come in and they find a few other things wrong under the hood, so to speak. And I think that really does bring trust for patients to realize like when you go to Comfort Dental, you're really just going to get like, this is what you actually need,
Right.
nothing else.
Right. Yeah. Yeah, exactly. Yeah. You should not need to, we don't have to pad our treatment. You see it, it's there. This is what you need for sure.
Now, doctor, I know there's a lot of people that just, struggle affording the cost of dentistry just in general. Like how do you, or how does Comfort Dental try to address that problem?
Well, we have the gold plan, which is what we would bring up in that situation. And if you do not have insurance, if you don't have insurance in your future, um, for most of the population, our best solution to that is the gold plan, which again, hands down, I've never had anyone bring me another office's, fee schedule that's less than the gold plan. So that's our go-to. And that helps us sleep at night because it's kind of set, it's a set thing that, every office does. And you don't have to kind of guess or make up what you think the price should be. Again, if you're doing just one or two things to the patient and they don't have any interest in buying it and they're not going to be around for long and it's a temporary thing that they need, you can do your cash price, a UCR fee, and then take 10% off of that. But we do offer the very affordable dentistry. We have low costs, and that's how I think. Again, the patient has to make a choice based on what they can pay. But I feel like we have the best option at money than any other practice out there.
Do you find that patients commonly, I don't know whether it's get quiet or just kind of wonder like if there's anything hidden because it seems too good to be true? Like, do they struggle believing that there isn't some weird hidden thing in this gold plan? Because it sounds like it's just meant to help them afford dentistry. Like, it sounds like it's just a win-win.
Yeah. No, I mean, again, I present to them the office visits. To me, the hidden, because I know they market the gold plan where cleanings are free. They're not. It's $30 for an office visit. So technically a cleaning's $30. So I find that frustrating. I know, I understand the marketing behind it. The cleaning is free. Every time you come into the office, there's a $30 office visit. And so that's what I tell the patient. And I have had some comfort doctors, mention to me, I'm not an insurance salesman. Like if they come to me, ask me about the gold plan, I'll talk about it. But again, if the patient doesn't have insurance and they have a lot of work to do, the gold plan is brought up and I print off a treatment plan for them and I put the office visits in there and I will say straight up, every time you come in, there's an office visit. And the reason they do that is they're trying to encourage you to do more work at one time. Like, let's not just do one tooth a month. But if you can only do one tooth a month, we'll do one tooth a month, but it's $30 every time you come in. So, but again, $30 in the big picture of I've had patients bring me treatment plans from other offices and it floors me. Absolutely blows me away how much our local dentists are charging for certain things that we do for a third of the price, even when they have insurance. I don't even understand. I've only done Comfort Dental, so I don't understand how they upcharge patients who have insurance. I don't get that part. But yeah, it's crazy. We
So
accept
you,
the same policy and the prices are totally different.
so like without a shadow of a doubt, that if someone's looking for quality of care and affordability, you are 100% the best option.
100%. Absolutely.
Um,
That's why I'm still here.
what is one thing you wish every patient understood about taking care of their teeth?
Floss. It's floss. It's floss. They have to floss their teeth. Doesn't matter how great we are. It doesn't matter how many times a week you come into the dentist. If you're not at home brushing and flossing, it's going to fail, especially with, the new fillings, the white fillings. I personally don't feel like they last as long as the silver ones did, but we don't even offer silver fillings anymore. You have to get the food off the margins of your fillings and your crowns. Um, you have to floss. So if anyone needs to know anything, it's floss. That's the Hollywood secret.
So, doctor, how often do you see patients who waited a little too long to address a problem? And what is it that you tell them?
I mean, we see it every day, and we tell them, I see this every day. I mean, it's chemo, it's someone in a car accident, so I was taking care of somebody else, I lost my job, I moved. I mean, and we see it all the time. Yeah. And again, teeth don't tend to be on someone's mind until all of a sudden they're sensitive. And then oh, it's been a long time since I've done that. And then they go in. So yeah, we just, if any, and I don't have a ton of people that are embarrassed, but whenever someone is embarrassed, I'll say, oh, please, we see this all the time. There's nothing to be embarrassed. It's our job. We're used to it.
Now, tell me, what is the connection between oral health and overall health that most people don't know about?
Um, I mean, obviously oral health is important to anyone's overall health. Unfortunately, I feel like, especially in the type of dentistry that we take care of, oral health is bad because their overall health is bad. So I feel like the conversation. I did an interview for my daughter. She asked me to go to a medical conference for school at Warren Tech here in Colorado, and there was an oncologist, a female oncologist, myself, and then a speech therapist. And we were trying to come up with a skit to go over with the kids when they came into the class so they could see how all of our jobs integrated together, how each one had a part in someone's life when they got cancer. And when it came to me and my turn, I kept saying, after the patient goes through chemo, they'll come in and see me, and they tend to have root decay. The chemo causes dry mouth, the medicine causes dry mouth or vomiting. So then they have lots of dental problems. And the oncologist looks to me and she goes, I didn't know this. I've never talked to my patients about this. I've never asked about it. I've never brought up, ways of preventing this. I didn't know. She's like, I've never really thought about this. And I'm like, oh, that's what we get. We unfortunately, yes, oral health is very important to someone's overall health. But I feel like the types of people I care for, their overall health, unfortunately, is what went bad. And then I get them when they need it. Everything is kind of falling apart, whether it be, again, car accidents are big, cancers are big, caring for elders, not caring for themselves because of family, depression. That's another big one that we see. And so, yeah, oral health is very important to overall health, but I feel like people definitely need to fight overall health more, unfortunately. And then they would have less oral health problems. Is how I would answer that question.
Tell me a little bit more about like your practice, the neighborhood, and just the community. Like, what's the community like?
I mean, we are right outside of Cherry Hills Village, which is one of the nicer neighborhoods in Denver, and we see a lot of very poor people. We see a lot of patients who have addiction problems, drug problems, alcohol. We see a lot of homeless. Our office does carry a grant program for seniors. We see a lot of patients. That's more throughout the state where they'll come and see us because we accept this grant program. Um, so the neighborhood that we take care of is oddly diverse, considering it's located where the location is, I would say. Yeah, but one thing I appreciate about my office is they're good people, and they're grateful. They're not what a lot of dentists call high maintenance. They are just grateful that we're going to get done what we get done. So, and I do feel like I have a lot of realists in my office that were like, "I knew, doc. I knew that. I'm surprised you could do anything with it." And that's much more refreshing than someone like, you can't fix this. And it's like broken past the gum line. And you're like, nope. So it's a great group of people. I feel like 90% are really very enjoyable. Love to work on them.
I
And we
love
have 10%.
I love that you make the distinction. Like, you'd rather have the realists than those that are just like drowning in denial.
Yeah, it makes it hard. Those are, oh, yeah, that's tough. That's tough. Those are tough ones.
So I'm just even trying to think, like, you have all these patients coming in. It sounds like, so typical day, is it just like going from patient to patient? Are there also walk-ins coming in? Is the schedule getting like pushed around?
I
Um,
mean, yeah, I think if one thing I would love for patients to understand, and until it happens to them, they won't, is how our day can go astray. Like it can just completely get off. Sometimes it starts as soon as we start, and sometimes it builds. A patient, comes in with a broken tooth, or we thought we were doing this treatment, something happens, now we have to extract it. It takes me 20, 30 minutes to extract it. Um, it is very, we make these appointments for a certain amount of time for a root canal and a crown. The patient comes in, that one's not hurting me right now, this one's hurting me. And it's a third molar extraction that now I have to sit down and take my time to dig out. And it's not as, I can't get up and leave. And so yeah, it is crazy how some days are great and everything flows. And then some days, yeah, it can be chaotic, and that is something that you wish you could write a letter and put in your front office that says, "Please be kind," because we are not having lunch, we are not on YouTube, we are not hanging out, we are working back there. Please understand that. And I do again, I tend to talk a little too much, so I do run behind sometimes, but we are working hard and we are trying to take care of everyone. And I have a lot of people who like, you can't take care of this today. And you're like, I got to take care of this today, don't I? I mean, you can't go home like this. So yeah, it can be very frustrating, and it's not frustrating until someone gets mad. And we're fine and we'll do it all until people start getting angry because they're waiting because they need a cleaning. And you're like, okay, trying here. So yeah.
Tell me a little bit about the culture of your team and how, as a team, you guys handle that.
I am so very blessed with my team. My team makes me look good, makes our entire office looks good. And I'm scared to give too many compliments because I don't want it to change. But we have a very mature and a very educated and a highly talented team, um, from the front to the back. And it really has helped us be more productive, and look good. They make us look good all the time, and I try to tell them that all of the time because they really are the backbone to our practice. So, but our team, I mean, again, the front staff, the way they would handle it is saying, "Hey, the so and so has been waiting. How much longer?" And I'll, depending on what I'm doing, either give them the eye roll, like it's going to be 20, 30 minutes, like let them know. Or, I went ahead and rescheduled so-and-so. Um, and then our back team, they know like certain doctors, some of us, we don't want them to keep bringing patients back if we're buried in blood and can't get out of a room. And, they read us, they know, what we like and what we need to get out of one room and get this patient taken care of so that we can, go to the next. So no, I'm very, very, the team is everything. It's everything.
Now you mentioned, I think twice now, that sometimes you fall behind because you say you talk a lot. Now, is that talking like I'm connecting with my patients, or is the talking like I'm having to kind of explain and be patient with them to let them know what the treatment option is? Like, what would you say describes most of that
No, I
talk?
mean, it depends on the patient. One that stands out in my mind, she struck me as just unhappy, and she struck me as someone who didn't trust me. She And it was making me nervous in the sense where her teeth were bad. And the types of cavities she had, the ones that are at the neck of the tooth and go in between and all the way around. In a perfect world, you would crown her teeth. You would put crowns on them. She couldn't afford that, and I knew that. And she thought she was coming in for one or two fillings because, and the reason she was with me is her last dentist, she had the cleaning, everything was fine. And then it felt like every time she came in there, the guy was telling her something new. Well, now you need this, and now you need that. Well, then when she saw me, I presented quite a bit of work. And what it came down to is she had type 1 diabetes and severe dry mouth and just getting root cavities. And it wasn't until we had the conversation past her x-rays and when she was really upset with, well, why now? What did he do wrong? And why didn't he tell me this? And, I feel like it's just getting worse. And is it something that he's doing, the dentist? And I was like, you've got no saliva. These are called root cavities. And it was not until she talked about the medication, she talked about type 1 diabetes that I was like, I think this is more of a dry mouth issue than, and it's starting to catch up with you because you're getting older. That was and she appreciated the conversation. She didn't want to do the work. She actually came and we did the entire treatment plan, 2 teeth at a time. It took us forever because she couldn't afford it. But I think she appreciated that she just needed to know it wasn't her fault and it wasn't the dentist's fault, like bad dentistry. Like she needed in her eyes and her head, I think, to feel it, I have a medical problem and that's why my teeth are bad. But it took me time. I didn't know why. It took a lot of conversation and to figure out what was really causing the problem. It wasn't the last dentist, it wasn't his fault, but it was, you have no saliva and you've got root cavities everywhere. And but what do you have going on? Like, what's wrong? Are you on chemo? Do you have radiation? No, no, no. The only thing I have is type 1 diabetes. I'm like, what, does that cause dry mouth? She's like, oh, I have really dry mouth. Oh, someone's like, yeah, I didn't diagnose. We figured it out, but just by having a conversation, and that made her, I think, trusting, which I'm not trying to, get trust, but it's nice. I think it kind of solved her problem. Now we can put fluoride on it. Now we can increase our water and decrease our sugars and, have a plan. And I think that at least gave her some sense of I'm getting somewhere. So that's why I get behind because it's like a mystery sometimes. And again, you don't know when those patients are going to walk through the door. You don't know when you get that mystery one that really needs you to figure out what's going on. And it takes time, it takes conversation to sit and figure it out.
Okay, that's amazing, and it's incredibly inspiring.
Ooh.
And just even for you to have the discernment to know when to lean in and take more of that time versus like you saying, sometimes it's like, look, I know I don't have any time. We got to figure something out a lot quicker. Um, and I'm guessing it's probably just going to be this based off your experience and how to navigate those different situations, which takes experience, and that is something you have, that maybe a young doctor wouldn't necessarily know how to navigate that. I know just from all the dental friends that I have that the hardest days in dentistry are when it seems like the patients aren't appreciating your work,
Mhm.
maybe don't understand how good it is or what it is that you're doing for them. Are there certain patients along your journey that you've kind of just clung on to that, I don't know, the transformation that you made or something that made you feel good so that if you have a tough day, you're like, you know what, this is still why I'm doing dentistry. Is there a story like that?
I mean, no, the one I just shared stands out. I mean, there are definitely some that stand out. Um, I think the day that we stop getting upset with patients that are mad at us for something or unappreciative, then we're not going to be good dentists anymore. You're not, maybe it's time to retire. Like, as much as we always blame them for getting upset, we have to have at least a second and think, all right, I shouldn't be running this far behind. Or, um, you know, we have to look at ourselves. We have to constantly be looking at ourselves and making sure that we aren't the problem. So, people are going to be upset. And you can't fix them all and you can't take all of it to heart because it's not all of our faults. It's just not. But definitely have to take that moment to be like, oh, did I handle it right? Could I have handled it differently? So I don't know if that answers that question,
No,
but
no, that's
I
great.
don't have a lot of, I mean, again, we see so many people. It's strange how, you know, I'll see people and I'm like, oh, I feel like I should know this person. I don't remember them all. I just simply can't. You try to do your best for everyone that walks in the door. And I want to touch back on, I've heard you say a couple of times about younger docs. I was a young doc too before. And I want to not to talk about the comfort model, but it helped me having a husband who also did this to help me bounce questions off. But I now have two partners that are both younger than me, and I bounce treatment plans off of them. Hey, look at my root canal. Hey, look at this. Hey, what do you think about this? Just the other day, I was like, what med would you give for this? So, these young guys, you have to, everyone, we call it dental practice. We're all practicing, we're all getting better. Um, I will say comfort allows young ones to get better quicker, for sure, because you have a lot of, you're seeing a lot every day and learning from that constantly. So, and if you've got a good senior partner, they'll learn from that. So I don't want to pick too much on the younger guys. I'm very sensitive to that because being a young dentist, it was not an easy thing, but no one's ever going to get better if you're not out there trying. So yeah, it's a
No,
process.
I love that you're so filled with compassion and grace because you've been there and
You've been there.
you
It was
understand
not easy.
the profession is very challenging. And that's why I totally understand why so many of the dentists that I'm talking to in Comfort Dental are such fans of the model because it allows them to practice on their terms where they're not wanting to have to wonder if their schedule is going to be full tomorrow.
Mhm.
If they're going to have consistent new patient flow, they don't want to have to worry about the marketing and figuring out how to generate leads. They want to be chairside. They want to be in a team where they're proud of the culture that they've been able to keep, and they know they're giving great dentistry and doing great care, and at the same exact time making a good living.
Mhm.
Um, and I think that's the best for the doctors, and I think it's the best thing for the patients. Now, doctor, I'm curious, like you at your best, what would what what do you feel like a patient would what would you want a patient to say describing you at your best, let's say after a visit? Like one word.
She was nice. It doesn't have to be any more than that. If I can do dentistry on someone and they think I'm nice, I'm winning.
Do you remember like the best compliment that you've ever received from a patient?
I it's taped to my wall in my office. It happened this year. I had a patient bring me whatever the Filipino money is, 50p, and he wrote on this piece of money, um, thank you for doing my root canal. I was able to go to the Philippines and ask my wife to marry me all because of you. And I have that taped to my wall. I did not know at the time that I was helping this man in such a way. I knew he was taking a trip. So again, I made the time in my day to do the root canal. And we finished the crown when he got back from his trip because he literally was like leaving the next day. And I did the root canal, put him on antibiotics. And it was, again, perfect scenario that we could actually get him numb and actually do the work that day. Um, but yeah, no, he wrote me a thank you on a Filipino 50p, and I have it taped to my wall because that meant a lot to me because I was completely oblivious that I was doing something great for him, and I appreciated the shout out for sure.
That is probably one of the coolest things, just because there's a chance that a patient doesn't take the time to
Right.
acknowledge and say thank you in that way. And
Mhm.
yet, I'd like to believe there are so many more stories like that,
Yeah,
where it might seem like a common patient, a common moment, a common experience, and yet it's anything but common for them. And
yeah.
to know that that's the power that a dentist has. Okay, so finish this sentence. Every patient deserves.
You to listen, to really listen. It's hard. It's really hard to stop and listen sometimes, but you got to listen.
Where did you learn the whole seeing people as people? I know that it sounds kind of common, but I'm just saying it sounds like you really are trying to treat every individual person, understand what it is they need, and try to get to that really, I don't want to say quickly, but I'm just saying in an efficient way where it's like, this is a new person that just showed up, and keeping that instead of just the figures, instead of the law of averages, instead of just this is probably what it is, it really seems like you have a calling to serve people.
Well, if I keep it humanized, then it makes worth doing. I mean, leaving my family and, you know, being stressed for the 12 hours, running around like a crazy person for 12 hours, it makes it worth it whenever I'm helping. And so I keep it human. It's like, I don't know, self-preservation to keep it human because it's worth it then. And it makes you be good at it too. Like I have to remind myself, like, especially if I'm having a bad day going into work or I, didn't sleep at all or had a rough whatever, when you're pulling in the parking lot, you're like, all right, you're here to do good. You're here. Don't forget why you're here. Like put it all behind you and go in there and give it your all and do it. So, and again, I'm super blessed that I don't do it every single day. I'm not um what's burnt out because I work part-time. And so it might be nice for me to sit here and sound like this. I am not burnt out. I get to do this 2 days, let's say, a week. And that's a really sweet spot to be in. I still get to enjoy it. And I have to give a shout out to my husband, who he is a full-time doc. Um, so to the ones who are out there busting their butts, they work very long hours. I get to be a little bit more, what's the word? This is amazing and this is great because I'm not burnout. I'm a part-time doc. So I want to throw that out there because when I do have to work 6 shifts a week, I'm like, ugh, people are driving me nuts. So, I mean, I have to say, like, I get to humanize it and I get to really enjoy it because I'm not burnout. So.
Okay, so final question. If a prospective patient right now is listening to this and thinking about scheduling their first appointment, what would you say to them?
Come see us, please. We've got you. We'll take care of you. It's that easy.
Dr. Jackie Blasko of Littleton, Colorado, thank you so much for letting me interview you today.
Yeah, thank you.
Thank you for listening. You can learn more about Comfort Dental at comfortdental.com.